In health news, there is new information about another possible risk for developing autism. It has to do with a common medical intervention many pregnant women receive during labor. Marley Hall reports.
Researchers have found a link between a pregnant woman's labor and the risk of having a child with autism. A new study from Duke Medicine found that inducing labor and increasing the strength or frequency of contractions may raise the chances of autism, especially in boys.
What we found was an elevated risk of around 35% for males who were induced and augmented.
Autism affects approximately 1 in 88 children in the United States. Doctors don't know exactly what causes autism, but scientists suspect genetics and environment play a role.
This study gives us another environmental factor that may be influencing risk for autism. Again, while these findings are preliminary and the risk was modest, it still raises some red flags.
That's because about 20% of births in the U.S. are induced and about 70% are augmented. But researchers caution the study doesn't show that these measures actually cause autism and that more study is needed.
What we haven't found is the reasons of the increase. It could have something to do with the circumstances of maternal health. It could be events at birth, or it could be the augmentation or induction process itself.
Doctors say the best advice for women is to learn about typical childhood development so you can spot the early warning signs of autism. Marley Hall for CBS News, New York.
And you just saw him in the piece. Michael Rosanoff joins us here now. He is the Associate Director of Public Health Research and Scientific Review for Autism Speaks. Michael, thanks for joining us.
Thanks so much for having me.
So big news. This is a significant study, but how important is it we hear studies, periodically about autism?
Yeah, I'm happy we're covering the subject. It's an important study not just for families affected by autism, but also for pregnant mothers or expecting parents or soon-to-be expecting parents. This is something that a lot of people can be exposed to, and so even though the risk was modest, it wasn't that large, it's still alarming because it is a common exposure. We need to understand the mechanisms behind it.
Right. Now, the researchers have stressed, and we heard about that in the piece too, that it doesn't necessarily mean that just because your labor is induced, your child may be on the autism spectrum. More research needs to be done. What sort of research?
Absolutely. So you brought up a very important point, and that's that there's no causal association here. In other words, the induction or augmentation of labor does not cause autism. But you're right. We need to understand those underlying mechanisms. Is it the drugs that are given to induce or augment labor, or is it the conditions leading up to a doctor's decision to actually go ahead and induce and augment labor? We just don't know from this study, but that's the foundation for the next step in research.
Right. One factor to continue to pursue. What are some of the other factors that science is looking at?
Yeah, so what this study reminds us is that the time during pregnancy is a very important time during child development, and it seems that a lot of the risk factors we're finding are occurring during that pregnancy period, that prenatal period. So we've seen things like a mother's exposure to air pollution as being a possible risk factor. Also, we know parental age seems to be a consistent risk factor for autism, but we're just beginning to put the pieces of this puzzle together. This new study gives us another piece.
So, if you're pregnant and you hear this study, I mean, it's got to make you nervous. No one wants to have to sort of argue with their doctor after 24 hours of labor that no, don't give me any drugs. What do you say to pregnant women out there?
No, absolutely. So going back to the puzzle idea, we're starting to put the picture together, but it's still not clear enough to change the way doctors will make recommendations or the way parents should act right now. But the best thing to do is to talk to your doctor about concerns, get educated on what a healthy pregnancy should be, what typical development looks like, and then of course try to learn those early warning signs of autism.
Let's talk about those early warning signs. What are some of the things you should look out for?
Yeah, and I'm so happy you asked. It's very important for families to understand. So things like not making joyful expressions, not sharing a smile at 6 months of age is one, no babbling by 9 months of age, no words by 12 months are just some of the early warning signs. Lack of eye contact is another. What you should do is go to autismspeaks.org. We have a whole list of the early warning signs that all families should be aware of.
And I think that parents need to know that there is a lot of help out there that, if you see some of these warning signs, get on the internet. You'll find that there's a lot of support, correct?
Absolutely. Come to our website. One of the things that we've seen in research consistently now is that earlier intervention leads to better outcomes. So identifying autism early, speaking to your doctors as soon as possible, and then getting into those services is so important. That's what we're trying to achieve here.
You talk about early intervention is so important. A lot of parents may think that if you get this diagnosis, then, all your hopes and dreams for your child are sort of dashed. Not necessarily the case.
No, it's not true. Parents should really be hopeful. It's a matter of understanding understanding what some of the treatments are, and seeing that families can benefit from these services. You know, children can go on to lead very productive lives into adulthood. We need to make more opportunities available for adults, but I think we're getting there, and we're getting towards a more caring society, and that's what's important.
There are plenty of success stories out there. Michael Rosanoff, Associate Director of Public Health Research and Science for Autism Speaks.
Thank you so much.